Good morning, and welcome to our newest edition of United We Learn. Thanks for joining us. I'm John Kelker, president of Your United Way. Today, we will bring you information regarding the ALICE project, one of the biggest achievements our network of United Ways across the state of Illinois completed in 2019. We introduced the ALICE report in early March of 2020 and hope to use it to shape critical conversations about the true picture of need and risk in our community. And then, like many things, the pandemic impacted our ability to engage the community in the way we originally intended. During our program, please ask questions using the chat option. We will wrap up in 15 minutes, and United Way staff will stay on to address any of your questions. If you are watching the recorded version and have a question, please send them to feedback@uwcil.org. Joining me today to discuss the ALICE report is Katrina Hayes, our Director of Community Impact, Ethne McMiniman, the Director of United Way of Illinois, and Heather Wetzel, one of our Education Vision Council volunteers and the Assistant to the Chair of Population Science and Policy at SIU School of Medicine. At the conclusion of our presentation, I hope you feel a deeper understanding of why many of the problems United Way and our partners address every day are so complex, and also a glimmer of hope that there could be actionable change and solutions we can all be a part of. So, to introduce ALICE, I'll turn things over to Katrina.
Good morning, everyone. Each day in our community, we have thousands of families and individuals that wake up, go to work, run the race, and come home to a mountain of questions. How are we going to pay the electric bill this month? Does Tommy really need new shoes? Maybe if we can get assistance on the mortgage this month, I could afford to pay the back due medical bills from the accident. The trade-offs and the questions never end, and sadly, these questions are even more simple than the ones individuals and families called ALICE face. ALICE, shorthand for Asset Limited, Income Constrained, Employed, refers to individuals and families with income above the federal poverty level, but not high enough to afford basic household necessities or save for the future. These working households contribute to Illinois' economy by earning, spending, and paying taxes, yet they struggle to make ends meet. With the cost of living higher than what most people earn, ALICE households live in every county in Illinois, urban, suburban, and rural. And they include women, men, young and old, of all races and ethnicities. ALICE is the home health care worker who helps seniors stay in their home and live independently. ALICE is the daycare worker who looks after our children so we can go to work each day. ALICE fixes our cars, works in our local grocery and retail stores, and serves dinner at our favorite restaurants. Across Illinois, ALICE is the backbone of our communities, working hard but often not having enough health insurance, vacation, or paid sick leave. Due to low wages, limited work hours, and a lack of savings, ALICE lives on the edge financially, struggling to meet basic needs and unable to save for the future, let alone weather a financial setback, such as an unexpected medical bill or car repair. In Illinois, 36% of households cannot afford basic necessities, including housing, food, childcare, healthcare, and transportation. And in many parts of Sangamon and Menard counties, the percentage is even higher. So just what are these numbers based off of? Using many different resources, the experts with United for ALICE out of New Jersey have developed best practice data sources to determine what is called the household survival budget. Shown here for Sangamon County, the most basic of necessities someone would need to take home. An individual would need $19,548 per year or $60,288 as a family of four. The household survival budget reflects the bare minimum that a household needs to live and work today. It does not include savings for emergencies or future goals like college. So you may be thinking, and it was my first reaction, wait a minute, This seems far too low to survive locally, that even your basic costs, such as childcare or rent, is much higher than what is shown. You wouldn't be wrong. After all, we called it the household survival budget. In the Alice report, you will see the cost of the household stability budget showcased and mentioned. The average household stability budget is 66% higher than the household survival budget. The spending amounts in the household stability budget are those that can and should be maintained over time and are upgraded from the survival budget. For example, the new housing costs cover higher quality housing that is safer and needs fewer repairs for a moderate house, and a one-bedroom apartment for single parents and adults. Childcare has been upgraded to licensed center-based care where quality is fully regulated, but we know more expensive. Food is elevated to the USDA's moderate food plan, which provides more variety than the thrifty food plan and requires less skill and time for shopping and cooking, plus one meal out per month, which, as you know, for a working family is more realistic. And transportation includes leasing a car, which provides more safety and reliability for working individuals and adults. So while Alice may be defined by a series of numbers, it is about the struggles of those families the report tries to address. Working full-time or multiple part-time jobs and still not being able to fully support your family. So the question of what can we do about it starts to take hold. To talk about how this report is being used from the statewide perspective is our Director of Statewide Policy and Advocacy for United Way of Illinois, Ethne.
Thanks, Katrina. First, many of you may not know that there are 44 United Ways throughout the state, and collectively, we help to invest more than $77 million into programs and services throughout the state. Outside of government funding, we are the largest private human service funder in Illinois. With this comes a great deal of responsibility to help continue to drive change for our state. As each of our communities do better, so too does our state. The Alice report helped us establish a common agenda around a problem that is often left unaddressed throughout the state. Programs and subsidies often are unable to support Alice families because they make a little too much to qualify for support, but not enough to meet their basic needs, such as housing, childcare, and food. Through this work, we joined a consortium of 21 states that are looking at and working to address this problem. So the question is, what will we do about it? Our first goal is education. The Alice report provides us a county-by-county view of poverty and economic hardship in Alice families for all 102 counties of Illinois. The report goes further by breaking it out by towns. This becomes a powerful tool for our elected officials to understand more clearly what is happening to Illinois families. By establishing the Alice report in Illinois, it also allows us now to have a baseline that will be a helpful tool in understanding whether or not new policies and programs are making real and lasting positive changes for our Illinois families. It will also give us a tool to understand how hard it is for families to weather the storm of this pandemic and to measure how long it will take for our communities to recover. After education comes policy. How can we approach critical issues and develop bipartisan solutions to help families live more stable lives? As the Director of United Way of Illinois, this is my primary role, along with our legislative and lobbying partners at Necritz Amdor Consulting. And last, but certainly not least, we have to work together across Illinois counties to look at the programs we are investing in and ensuring that we are supporting programs that are driving the most impactful outcomes for individuals and families. To discuss more about this local work, I will now turn it over to Heather.
Good morning, and thanks, Ethne. As a Vision Council volunteer at United Way, I know my role is twofold. For one, we are continuously reviewing the process and progress of our program investments and discussing ways to create more innovative solutions and resources to support them. And for two, we think critically about the direction that United Way is going, and we work together to ensure United Way is fulfilling its roles as convener, collaborator, and change maker. However, both of these roles as a volunteer really come down to one thing for me, which is how are we improving the lives of people our programs are working with. And when individuals think about United Way grant-supported programs, they typically think they serve families living in poverty, and 96% of families served are. This report challenges us as Vision Council members to think about our current strategies and question if and how we need to expand our approach. In December, all of our Vision Councils are coming together to discuss the findings in the Alice report and answer the questions of what this means for our local families and what this means for United Way of Central Illinois. One of the elements of effective community impact is turning outward to listen to our community, and this is my invitation to you today. After you read through the report and review the Sangamon and Menard County pages, we invite you to provide your thoughts and ideas. We've created a short survey about the Alice report, and we would love your feedback. The survey, which is accessible through the link on your screen, will ask 3 questions about what you read and what you think we should be doing about it. Collectively, the 4 Vision Councils and our amazing volunteers, along with your voice, could help shape the next steps for United Way to help build Sangamon and Menard counties into a vibrant region. Lastly, I want to provide my personal thanks to the local volunteers who served on the committee that reviewed and finalized this report on behalf of our state. And with that, I will turn it back over to John.
Thank you, Heather and Ethne. It's been great to have you join us. And thank you, Katrina. And of course, thank you to everyone who's joined us this morning. Today's United We Learn highlights just how close United Way's work is to each of us. To me, the Alice report is the biggest reminder of how our neighbors need us more than ever to ensure they have the support and assistance they need. Our next United We Learn on December 4th will highlight several programs United Way administers to provide financial relief to individuals and families. The information provided should be of particular interest to anyone working in HR. I hope you will join us and tell those in your HR department to join us as well to learn about these programs. This concludes today's program, and we will keep the session open for a few minutes to address any questions that we have posted in chat. Any questions we don't get to in the next few minutes will be addressed and saved on our website. Thank you. Have a great Friday and a wonderful weekend.